Estelle Willie joins us, Director of Health Policy at the Rockefeller Foundation. She joins us from Bélem, Brazil, and she is at COP30. Good evening, and thank you for being with us here on France 24. We really appreciate your time. You must be alarmed at the report from the UN talking of climate refugees, but perhaps not surprised because you're well aware of the issues that they're facing.
Yes, absolutely. First of all, thank you so much for having me on. I really appreciate it, especially to raise awareness of such an important issue. You know, extreme weather is here, extreme heat is here, and it's really driving people all over the world to the brink. When you hear the stat, extreme heat kills one person every minute, and it's impacting your life and your livelihoods. It's driving people, forcing them to migrate. And we're only going to see this issue become worse and worse if we don't act.
Indeed. And as we're talking, of course, people in the Philippines are still underwater from the typhoon that struck. We understand another one is on the way. There have been all manner of disasters this year that we've all been reporting on across the whole news output agenda. But nonetheless, the issues are still there and perhaps not being acted upon. The UN calling for more funding for countries to combat the negative effects of climate change. Do you sense at COP30 this is going to happen?
You know, COP30 comes at a really, really important time for the entire world. And it's really going to be a way in which we see multilateralism work slowly, but work. Right now, you know, previously in previous COPs, there's really been a focus on mitigation, which means, you know, the phase out of fossil fuels. But in this COP, we are seeing both mitigation and adaptation rise to the forefront because of the leadership of the Brazil COP30 presidency. And adaptation in the health community is development. It's what are we doing to adapt so that we can live on this planet? And the COP30 Brazil presidency is doing everything it can to really elevate this issue, both from the negotiation side through the global goal on adaptation, in which all nations right now in rooms right here are negotiating the operationalizing of the Bélem Health, of the global goal on adaptation, And then also on the other side, the presidential action agenda, the Brazil presidency has developed the Bélem Health Action Plan, which is going to be launched tomorrow. And this is really to help countries understand what are the evidence-based solutions that they can invest in now that can help save lives and secure futures in their country. So really seeing the Brazil leadership here in elevating this problem, really focusing on both the people impacted and the planet and how it's interlinked is just really, really great to see here.
Indeed, for some people, Estelle, your message is loud and clear that there is progress being made, but I'm thinking of some places that I've travelled to in Africa where you meet people who are really struggling just to put food on the table, and to ask them to make the kind of sacrifices that perhaps we ask of people in more affluent societies seems in many ways unfair. Is there any way to even that discrepancy out?
Absolutely. This is the terminology that they call means of implementation. At COP30, this is going to be the biggest part of the negotiation. How are you asking and expecting countries from the global south to sign on to the global goal on adaptation if the global north countries aren't willing to finance that work? So this is what's happening in the negotiations right now as we speak. Look, it's been years-long progress to get where we are right now. At Bonn, it was the biggest sticking point. The negotiations concluded really, really early morning hours at Bonn in June this year. So, and after that, there have been convenings all throughout the fall so that countries can come together. And this is really where the rubber meets the road. And I'm really hoping that we see some action here, especially from the global north countries who, you know, have done more to cause this problem with the use of fossil fuels than the global south countries who are really feeling the worst impacts of it right now.
You mentioned multilateralism. Clearly, Donald Trump isn't one of the people who would sign up to that idea. I won't get you to comment directly on Donald Trump because I think that might put you in a difficult position. But you mentioned June. 86 million people by June were displaced across the world, many of them facing problems of increasing heat. Are there any countries, out of their own means, with their own ingenuity, who are doing a good job?
Absolutely. We have countries like Senegal who have developed heat action protocols. And what this is creating an early warning system that brings together the weather, the meteorological community with the health community to alert the decision makers in local communities that there is going to be a heat wave. And this is what you do to stop the heat wave from impacting people's lives. So what this means on the ground is because heat is so insidious and it impacts every single sector of a community, it requires a whole of society response. But that means that every single sector in a community needs to be mandated to work together. And Senegal, what they did by mandating this through the heat action protocol, they were able to identify when the threshold for extreme heat happens. And when that hit, they're able to just cascade a whole bunch of different solutions. And these solutions are low cost and easy to do, but they do require planning ahead. So this is cooling stations, water, rest, in cash schemes so that people, daily wage workers, cannot work in the hot sun, but they can still provide for their family. These are simple things, but they do take quite a lot of coordination in order to facilitate this and to do it ahead of an actual problem. We're also seeing this in Malawi. Right now, they're doing a rapid vulnerability assessment. And from this, they're creating the evidence base to understand where are the vulnerabilities in their country. And from that, they're going to be developing a national health adaptation plan. And from there, that is the platform to bring in finance, domestic finance, and then also bring in finance from the World Banks and the IMFs of the world, and finance from philanthropies like the Rockefeller Foundation and others. And it's really a platform where it's saying, this is the country priorities, and we want you to come in to invest in this.
Estelle, I need to cut you off. Thank you so much indeed, though.
Yep.
Estelle Willie, I'm really sorry we have to cut you off, but that is absolutely brilliant. It shows that there is a lot to be cheerful about in terms of turning this around from what looks like a very disastrous situation. Estelle Willie, thank you for bringing that illumination into this story for us.
Yes, of course.
Thank you very much indeed. I hope COP30 continues to be a success for you and you see the results that you're looking for there in Bélem, Brazil. Thank you, Estelle, for joining us.